The silent struggle. Could genetic flaws be behind tragic infant deaths? October marks Sudden Infant Death Syndrome, SIDS, Awareness Month. A time when the stark reality that SIDS remains the leading cause of death for infants between 1 month and 1 year old comes into sharp focus. But here's where it gets controversial. Groundbreaking research is now suggesting that genetic predispositions might play a significant role in these devastating losses, offering a glimmer of hope for prevention. While the idea of genetic testing for newborns raises complex ethical questions, the potential to save lives is undeniably compelling. In St. Louis, medical professionals are closely examining new studies that could revolutionize how we approach SIDS. These findings indicate that specific genetic markers, often influencing brain, heart, and lung functions, could be key players in SIDS-related fatalities. Experts caution, however, that these genetic vulnerabilities don't act in isolation. They can be exacerbated by environmental factors such as unsafe sleep practices, maternal smoking, obesity, or even seemingly mild infections. This interconnectedness makes the research all the more fascinating and potentially life-saving. Imagine this: with a simple blood test conducted before or after birth, it might be possible to sequence an infant's genes and predict their susceptibility to SIDS. John Kahan, founder of the Aaron Matthews SIDS Research Guild at Seattle Children's Hospital and a former chief data scientist at Microsoft, puts it this way: the most important current research is that with a simple blood test, you can predict in advance if a child is going to have a high risk of SIDS, which is incredible. Kahan's personal connection to the research, his own son succumbed to SIDS, adds a poignant dimension to his dedication. Bryanne Colvin, a neonatologist specializing in SIDS and safe sleep practices at Washington University, acknowledges the excitement surrounding these developments. That grief and that guilt lives with them forever, and to offer some answers is really important, she says of her colleagues in SIDS research. Yet she wisely reminds us that while genetic insights are groundbreaking, the fundamentals of safe sleep remain paramount. In Missouri, approximately 60% of SIDS cases are linked to unsafe sleeping conditions, underscoring the need for continued education. Here's the double-edged sword Colvin mentions. Revealing an infant's genetic predisposition to SIDS could either empower families with critical knowledge or heighten their anxiety during an already stressful period. Families would want that knowledge just so that they can also then tell grandma, who wants to put the baby on the belly and things like that, she explains. This raises an important question for our readers. How much information do parents truly want about potential health risks for their children? The research, published in reputable journals like the American Journal of Medical Genetics and the Journal of the American Medical Association, reveals fascinating parallels between SIDS and other sudden death syndromes. Infants vulnerable to sudden unexplained infant death, SUID, a category that includes SIDS, share genetic profiles similar to adults who've died from sudden cardiac death, with approximately 360,000 sudden cardiac deaths occurring annually in the U.S. These connections suggest powerful avenues for future research. Jan Marino Ramirez, Ph.D., director of the Center for Integrative Brain Research at Seattle Children's Hospital and a co-author of these studies, elaborates, in many cases, multiple genetic variants that impact brain, heart, and lung function occurred simultaneously, making these children particularly vulnerable. He envisions genetic testing becoming a standard tool, not just for explaining SIDS, but for preventing it and other forms of sudden death throughout life. The impact can be huge, given that more than 1,000 people die daily, suddenly and unexpectedly, Ramirez notes. Kahan's perspective is equally compelling. If you find this early enough, you can actually test for it and help them have a long life. It's incredible, and we weren't looking for it. You can literally find somebody before they have a problem and track them through their whole lives and do something about it, which is really cool. This proactive approach represents a fundamental shift in medical thinking from reactive treatment to preventive intervention. While Colvin acknowledges that these genetic tests aren't quite ready for widespread implementation, it's not ready for prime time yet. She cautions, she remains hopeful about the future possibility of state-mandated newborn screenings that could identify genetic markers in an infant's first days. Until such tests become standard practice, Colvin emphasizes the timeless wisdom of safe sleep practices, often remembered through the ABCs: alone, in a crib with only a pacifier; back, sleeping position; and crib, a flat, firm surface free from positional hazards. All of those things can lead to what's called positional asphyxia, she explains. So, chin hitting chest, that tiny, floppy airway kinking over like a straw, they can suffocate. As this research evolves, Kahan continues his mission to fund SIDS research through creative means, including a children's book co-written with his wife Heather that combines wildlife photography with family themes. All proceeds support both the World Wildlife Fund and the Aaron Matthew SIDS Research Foundation. The path forward isn't without challenges. Ethical considerations, privacy concerns, and the potential for genetic discrimination all come into play. But one thing is clear: the combination of genetic insights and safe sleep practices could fundamentally change how we approach SIDS prevention. What do you think? Would you want to know if your child had a genetic predisposition to SIDS? How do you balance the desire for preventive knowledge with the potential for increased anxiety? Share your thoughts in the comments below.